Hi, I'm Dayton Mayor Jeff Mims, and welcome to another edition of In the Spotlight with Mayor Jeff Mims. And so today I have another special guest. Of course, all my guests are special, but you're the most special since you're here today. Ms. Sarah Hackenbracht, okay? CEO, Executive Director of the Greater Dayton Hospital Association. So people understand, who don't understand, what does that mean?
So
what is that job?
Our regional association serves 29 hospitals and health systems across the greater Dayton area.
Okay.
We go as far north as Auglaize County, and then we have hospital members down in Butler and Warren County, all the way over to Clark County. And we work with hospitals on a lot of different topics, but oftentimes we work with them on the areas in which we can find opportunities for collaboration, and specifically with a goal of oftentimes improving the health of the community and ensuring that the hospitals are serving the community and maximizing those opportunities.
Okay, that's great. You know, one of the things that I hear a lot about since they have reduced or minimized the aspect of teaching health issues as far as schools are concerned, it's no longer the full credit that's required, if you will, as it was back in the day, as they say. How does that impede or does it help minimize or accelerate the opportunity for more and more individuals to understand how to live a more healthy lifestyle?
So I think that was a foundation that kids were coming out of school with. They had a basic understanding and knowledge of their bodies, of how to better take care of themselves, what to put in your bodies, what not to put in your bodies.
Right.
And I think, you know, we're seeing the experience in the community where that education hasn't been prioritized. And so you have to restart in some of those settings with individuals and help them learn how to better take care of themselves. Some of that can happen in a doctor's office, but a lot of times that takes more time and direct in-person relationship building to really understand and trust the information that you're getting. And so I think that's where we see some benefit of services like a community health worker or a peer navigator to work with an individual and help them navigate the healthcare system, particularly if they haven't had a lot of exposure or experience to navigating the healthcare system for the first time.
Okay. Now, I know there are some healthcare advocates who've always said and pushed more extracurricular programs in schools, even starting in the elementary level, and talk about all the kinds of things that you're doing in those spaces. And some of the responses from the legislators has been, well, we'll give you a half a credit or we'll give you a credit if you're on a sports team. You know, and for those who are still not on sports teams, they still fall short in terms of learning sometimes healthy lifestyles, where some phys ed teachers would use that class to talk about the 5 different health foods and groups and things of that nature, as well as lifetime sports. And now it seems like they're almost gravitated towards maybe throwing out a basketball or a kickball and then maybe having a seat while the kids use 45, 50 minutes of their time. What are your thoughts relative to programs like that?
So I think there is a huge opportunity for all ages to be engaged in those lifetime activities.
Yes.
If you think about it, you know, you have football players who don't really play football into their 50s, right?
Right.
So think about, you know, the wear and tear that those kinds of sports do on your body. How do you also layer that for younger people to understand what those lifetime activities could be? So it's right now, walking with a weighted vest, super popular. But just getting out and walking here in this community, using our metro parks, using those trails and the access points that we've got all over the region, that's a fantastic way to continue to take care of yourself. Other things like yoga, that as you learn it, you don't necessarily have to always participate in a class. You can practice yoga on your own. And that's a huge benefit from not only physical movement and stretching, but from mindfulness and teaching yourself some strategies and ways that you can focus and breathe and keep yourself calm.
Okay, some great thoughts, good ideas, okay. I know having had both of my knees that I traded in last year because of they refused to function the way I want them to.
Yep.
Okay, so the therapists that I attended were working very hard in terms of all those type of things that you were talking about. The heavy on stretching, heavy in terms of lifting weights and the mobility flexibility, trying to get myself back to a position where I could maybe turn and hit the golf ball as far as I wanted to hit it. Okay, how's that? Of course, that's
exactly
never going
right.
to probably happen, but on a consistent basis. There's some other things that you're doing as far as the community is concerned. And I know we were able to twist your arm and talk you into being engaged with this whole Cure Violence initiative that we're working on as far as the city of Dayton is concerned. And I know you seem to have taken to that very strongly. Why do you think that's so important? And then what encouraged you? And of course, you couldn't do it individually without your board support. Okay. Why is it that you guys felt that was so important to be a part of making this peace initiative in Dayton a success?
So we remember some of the violent incidents that took place in the country back in 2019 and 2020. We've had episodes of that. And during that time period, the hospitals came together and then also came out individually with statements that really indicated that violence and racism are issues from a public health perspective that we need to address as a country. And I think very much the issue of violence ties into continuing that statement and taking it and translating it into tangible action that we can support in the community and that we can bring our hospitals into some of those community-based conversations. We know that having safe neighborhoods is a cornerstone of our social needs as a community. And that's one of the other reasons that it makes a lot of sense for us to be engaged in this work. We're a fantastic partner with public health, and we really want to lift up and coordinate and share those types of social need conversations and work together to find the best possible solutions for our community.
Okay. Yeah, I know I've been asked a lot of those questions myself in terms of why I work with peace, and when you start asking questions about what would you want in your neighborhood, what would you want in places that you play, what would you want in places that you work, what would you want in just maybe your place of worship, all those different things sort of come into play. And knowing, talking with some of the ministers on a continuous basis, as well as different police chiefs that we had here in the city and others, they've talked about the attitude about peace is foundational. That when more and more people have a understanding of how they enjoy peace, they're more comfortable, if you will, in terms of how you get more people to want to embrace that. And it's easier for them to sell, for example, especially when they look at some of the violent situations that are happening. And talking with individuals and saying to them, if your child or your loved one was one of those individuals that happened to be caught up, unfortunately, in a situation where they were injured or hopefully not killed, but injured, what would you want or what would you do to try to make some things happen? Then you have a lot of ideas about things that are happening. So from that perspective, it caused us to think about, looking around the nation at some of the results that we've seen with places that have put a major emphasis on peace on a professional basis and looking at what has worked in other cities. So, we jumped into it, So we're moving quickly. So your choice of being involved in terms of being the community-based organization to want to help lead this whole Cure Violence piece, what are your thoughts thus far?
So we are actually stepping in as really that interface organization. So we're helping the city develop the RFP, and we're going to help manage that process so that we select the community-based organization that is really homegrown from the roots of these communities that we're going to be leaning into. And then as that selection happens, we're going to be working behind the scenes with them, city leadership, and Cure Violence Global to really make sure that the strategies that we're developing with the community-based organization are ones that can be embedded and then expanded on even after that contract ends. And I think that's one of the beautiful things about this model is that it is meant to be something that lives on long after the relationship with Cure Violence Global ends. I'm sure there'll be a continuation of reporting information and data and making sure that we stay a part of that learning network. But as we start to learn and embrace this model, then the responsibility becomes ours as a community to teach it to others and to continue to grow and expand the relationships in the neighborhoods that this work is supposed to serve.
So it's interesting that you would say that, because part of the a joint project with the county, okay, and working also with the schools. We've identified a program to train or teach approximately 20 14 to 16-year-olds in conflict resolution skills, and then to move them into a space of working with some of the younger people, if you will, 5, 10, 12 years old, in terms of helping them understand the need for the whole peaceful set of skills that they use as far as life is concerned. So if you were looking at something of that nature, give me some of your positive thoughts about how you think that would work and what would that do as far as our community is concerned.
What a fantastic relationship that would help span generations, because the work that we're going to be embarking on with Cure Violence Global, those are really going to be a combination of violence interrupters and case managers to work at the local community level. They'll be touching some young people, but it'll be that span of ages that I think we'll see probably in communities ages 14 to probably mid-20s.
Okay.
Those individuals in our communities that we have a need and an opportunity to catalyze into looking at violence differently and reacting to violence differently. But if you have the ability to take that work and move it even more upstream and engage with children at a younger age to teach them some new strategies, it's very much what we hope to do in all aspects of health.
Right.
Same as healthy eating, stress management, physical movement. If we teach that and embed it in our lives at an early age, you start with that as a foundation.
Okay. Yeah. So again, if you're an employer, all right, and so you're interviewing individuals to work at your organization, if you have the opportunity to really debrief with them, to talk about their past experiences, and not only sharing this information and conversations with other business leaders, talking about the skill sets that young people would use if they're part of a team.
Yes.
Okay, and how does that parlay into how you will function if you go into the workplace? Yeah.
Teamwork is at the foundation of everything we do. Even when you think about our work as a hospital association and working with entities that are large healthcare providers in the region that in theory are competitors in a marketplace, because there are only so many people and they each want those patients to come for services at their facility. At the same time, if there is a crisis, if there is an emergency that we have to respond to as a community, they successfully set those types of issues aside and find that common ground to work together. And so I think if we can model that in every aspect of our community, that becomes opportunities for other young people to see how teamwork can be a part of their day-to-day lives.
Okay.
And you see that in families, you see that in the classroom, you see that in community organizations.
So we had a program that we do every summer with at least about 100 to maybe 200 or 300 young people that we engage in a program where they get to listen to some of our department heads, talk to them about what the kind of things are required to be an effective worker in those spaces, how to go through an interview, and what type of things are expected of them as far as an employee is concerned. Come to work every day, on time, with the right attitude. I want you to also understand how to lead, how to follow, and when to lead and when to follow.
Yep.
Okay, and then I want you to have some collaboration skills. So if there's another employee who's working, if they don't have the message straight, I need you to help me out. Okay, because time is money.
Yep.
Okay, when they're in those spaces, and then maybe looking at what would you think an employer would look for, or a manager of that office, if you will. What type of skills are they looking for, if you will, in terms of how those things benefit that department?
I think it varies based on the employer.
Okay.
It depends on the types of organizations that we're exposing young people to. But I think that's a key element, is giving young people the exposure at an early age to start to understand where do their interests lie, where does their academic ability put them.
Okay.
And then a lot of those skills that we're talking about in terms of teamwork and collaboration, they can be learned on the job too. So even if you don't come in with that as part of your background, even if you didn't get to participate in the Mayor's Youth Summit, with the right employer, those opportunities start to present themselves. but you have to be humble, you have to remain engaged, and you have to say, yeah, I'm willing to learn this, and I want to see myself grow and continue to get better.
Okay.
And even as a young person, I recognized early on that I probably didn't always have that attitude. And so it's one of those things that I remind myself now is to remain humble and to continue to recognize every opportunity as a learning opportunity.
Yeah. You know, as a former teacher and a coach, one of the things I was sort of blessed with, I stumbled upon this process of teaching conflict resolution skills with all my classes before we started doing the subject work. And even as we were doing the conditioning, for both soccer and track, okay, so we sit down trying to create this whole family atmosphere. How do we work together in terms of using your skills, and even to the point where some young people develop this attitude of using their academic class skills. For example, one young man who was on my soccer team, was really gifted in math and geometry and algebra, and so he took it upon himself to help anyone on the team who was having problems with algebra, and moving them to that space. And so excited that as he got the scholarship to Central State University to play soccer, the coach called me and said, "Man, you got any more like him?" I see. I got about 4 or 5 more guys. They'll be up there next year. Okay, in terms of moving that space. How does an employer feel to have a person in their space, in their camp, doing that type of work as far as working with not just management, but also working with his colleagues or her colleagues in that space?
Oh, I think that's every employer's dream. That is that individual that you just described. I mean, that is the dream individual for a lot of employers, because they're able to commit and understand what they're there to do every day, but they don't stop at looking just at themselves. They're looking across the team, and they've probably developed a really strong understanding that leadership doesn't have to happen from a position. Leadership happens based on how you interact and what you feel that you can bring to others in your environment. I would say if we could turn the city of Dayton into your classroom,
Man,
that would, we
Love to.
could catalyze that type of engagement and leadership and helping people help each other.
So where do you think we're going? 'Cause I appreciate that. As we do more and more in terms of how we attract businesses to come to Dayton, how do we attract investors to want to make an investment as far as Dayton's concerned? Dream for a bit. Just talk about some of the kinds of things you think that they would look for to benefit as far as the city is concerned.
I have a very specific lens coming from healthcare. I think we have the highest quality healthcare and services available here in this community, and we have a high concentration of healthcare services within the city of Dayton. We have a phenomenal children's hospital just right within the city limits, and they do phenomenal work, and then they're also partnered with Shriners of Ohio, and so there's a very specific specialty skill set for serving young people if that is needed. In this community, though, I think that represents just one of the avenues that we see in this community, where you have strong employers who have committed to the region, who are committed to the community, and are starting to lean in to understand how can we help grow the future of our workforce and create those opportunities here and help get those young people interested in earlier, so that we're setting them on that course for success when they're still in high school. Things like the choice scholarship opportunities, those weren't around when I was coming through high school. But now you realize that you've got young people starting their freshman year of college with 2 academic years of credit under their belt if they've really worked hard. That's a huge opportunity to cut down on that cost of higher education and then be plugged right into an employer here in our community.
Yeah. It's interesting you should mention that, because, we've had this great partnership with Sinclair in terms of the city, and some of the other mentoring programs that I've been involved in over the decades. And I know recently, at least over the last 10, 12 years, President Johnson from Sinclair has been able to find a way to give me at least 5 to 10 scholarships, 2-year scholarships for young men in my mentoring program, the Jack and Jill Botillion, for example, and to see some of the additional programs that they've added in those spaces as well. Yeah, I think 12 years ago, the African-American male graduation rates at Sinclair were like at 3%,
Oh, wow.
2 or 3%. And they have increased that now to the point where they're now 25, almost 30% in terms of the work that they've done by putting some additional programs at Sinclair in those spaces, using maybe some diversity programs, using some other kinds of things that engage young men in a variety of places. And one of the things that they've done in partnership with the city is to work on this aviation classroom, which is a big hangar right out at our airport. And so they do real-time class work in terms of aircraft maintenance and training in those spaces. And like you mentioned, some of the young people who are graduating from high school having that 2-year associate degree as well as their 4-year high school degree. Very, very special people, and we're trying to increase those numbers more and more, and that's happening because we do have all these job opportunities that we're waiting for. So good work in those spaces.
And what a great experiential learning model to get them engaged in touching hands-on activities that commits to their brain even stronger.
Yep. And you mentioned the situations with Children's Hospital. You didn't mention the new one that's coming up.
Correct.
Okay. So they got a new one. I think you probably know more about that than myself.
I know some, but I would also encourage you to have Debbie Feldman on as a guest because she would love to tell you all about the work that they've done with the Mateel Center. It is a phenomenal behavioral health centered space for children in this community. The challenges that young people are facing as they grow up and in society now are very different than what I experienced, what you might have experienced. And so I think Children's is really leading the way at helping families and communities understand that we need to support our children differently, and they need services and specialized tools wrapped around them at a very early age in order to grow into the adults that we hope that they can be.
So across the nation, across the world, we all experience this situation with COVID. It seemed like now, a long time ago, but still have some remnants of that still that affecting our community. A lot of that was around the aspect of isolation that young people have being involved in restricted situations because of the fear of spreading the disease. But looking at the isolation that they experience and then how they could transition out of that in terms of being a free-thinking person, feeling comfortable in different spaces. Can you talk about that from a health perspective, if you will, in terms of how you think those things affected people's lives?
Certainly. I think, those early months of COVID, if you remember, they were very scary because everything was new and unknown. And we didn't know exactly what we were dealing with in terms of infection. We didn't have a vaccine, or we didn't have treatment protocols developed. And so in those first 6 months, that was really a scary time to be in healthcare, because at that moment we were very reactive, and we had to be, because we didn't know exactly what this was or how quickly it would spread. And so I think your public health leaders and executives and others made the best decisions that we could with the information that we had at that time. I think as we look back, those stringent protocols around spacing and social distance, we know that they work in terms of spreading infection. The research is clear on that. Same thing as if wiping down surfaces with your Clorox wipes, all of those things work. The unintended consequence of the isolation had a very, very strong impact on our young people and on our older population. So those social groups that maybe don't have the same levels of mobility that day-to-day workers would have. So I think there's still a lot to continue to learn from that experience. We can always do better. And I think that's where we understand now that wrapping the social interaction into health is really important to who we are as human beings.
Of course, time is flying. I knew it was going to fly by quickly, and we're down to the last maybe a couple of minutes or so. I want to go back for a bit about peace. And you talked about the relationship, if you will, in terms of how you cure violence, the same way that you hire or cure diseases, if you will. And if you can draw just a quick parallel to that, and tell me again what your thoughts are as far as the future of Dayton from a peace perspective.
So I think there's a really interesting link that can be made about the importance of engagement and community. And that's going to be really one of the central elements of working with Cure Violence Global, is that these individuals aren't going to be representatives of the mayor's office. They're not going to be from the Dayton Police Department. They're going to be community members that are selected to step into these roles and start to help the community talk about what's happening differently. And so my hope is that when these violence interrupters and case managers start to engage, that they're able to build that level of trust with community members, because they're part of the community and they truly are there to help build in new strategies and tools and skill sets.
Okay. I know Boston, Massachusetts is one of the most peaceful cities in the world. I think they've been doing the cure violence work for approximately 30 years. Okay. I'd like to catch up with them.
I love that idea.
And try to make something happen from that perspective. So time's gone. Any last thoughts?
I think this is a powerful opportunity, and I hope that everyone really chooses to lean in.
Okay.
And I think we get to make that choice to choose peace and to choose that model.
Okay.
So thank you for bringing it to the community.
Thank you so much. I really appreciate you. So again, I thank my colleagues and myself for pushing this, city manager, all those folks who helped to make this happen for us. And of course, those guys at Cure Violence Global.
Yep.
You know, I know Q and Big, you know, they sound like some James Bond characters, but they were doing a lot of work.
Yep.
Or have done a lot of work in terms of helping us move through this process.
And we get to benefit from their knowledge because they've worked with so many other communities.
Exactly. So thank you so much. I really appreciate it. And
Thank you, Mr.
for
Mayor.
being here on the show.
Thank you.
Okay.
Thank you. Such
All
a
right, and
pleasure.
thank you for watching another edition in the Spotlight with Mayor Jeff Mims. And of course, we're going to be on our TV channel 6 and also on YouTube, and you can also catch us on the website. Again, thank you again. Have a great day.